Good morning, everyone. Thanks for joining us. I'm also joined today by Dr. Andy Robertson, the Chief Health Officer, who will be able to answer any of your questions. Can I just first of all start by again thanking Western Australians for doing the right thing. Since December the 23rd, West Australians have listened to the health advice and have done what has been needed. Mask wearing, no dancing and proof of vaccination. Through Christmas, New Year and some of the hottest days of 2021. We know it's been uncomfortable, we know it's been inconvenient, but we thank you very much for your diligence. Overwhelmingly, everyone did the right thing. Following the public health measures, getting tested, and most importantly of all, getting vaccinated. Yesterday, 33,009 people came forward to get vaccinated. More than 22,000 of those were third doses. That's an incredible result and very pleasing. And WA now has a first dose rate of 93.5% for over 12s. Our second dose rate is rapidly approaching the 90% mark also. And our third dose rate is now 12.2%, effectively growing at around about 1% a day, which is a great sign. I'd like to remind everyone that it is vital that people book ahead to ensure that we can spread the appointments out throughout the day. So we can get through as many doses as possible and to make sure that people can be as comfortable as possible in our clinics. WA is currently recording some of the highest vaccination rates that we have seen. But there is still plenty of opportunities to get vaccinated and ensuring that we can transition safely. Whether it's in our state-run clinics, pharmacies or GPs. Also a reminder that the location of the Claremont Clinic is changing so that there can be air conditioning provided and it is more comfortable. So for those who have been there before, you still enter through the Ashton Avenue side of the showgrounds. And you'll be directed to where to go and to park in regards to the new clinic. It is fantastic to see so many people rolling up for WA at this time of the year. As we all know, vaccination is one of the best things that we can do to protect yourself, to protect your family, and to protect the community. And most importantly, it's the best way that we can keep you out of hospital. I can advise that overnight, WA has recorded no new locally acquired cases of COVID-19. So I repeat, no locally acquired cases of COVID-19 have been reported overnight. So that is great news. 6 cases have been recorded related to travel, 3 interstate and 3 international arrivals. All cases are in quarantine. While there are no new local cases, contact tracing efforts are still ongoing. Specific times and any additional sites are being added regularly. So it's important that we keep checking the exposure sites daily and follow the health advice against each site, as they are regularly updated as new information comes to hand. And of course, not to mention the importance of using the Safe WA app and to check in wherever you go. In regards to the case of the Hyatt Hotel quarantine security guard and his household contact, together they have 23 close contacts that have been identified. The majority have tested negative, and importantly, all their work colleagues have tested negative. However, genomic sequencing has confirmed that the guard had the Omicron variant, which means in turn, his household contact is the first locally acquired transmission case of Omicron in the community. Now, while this is undoubtedly concerning, I want to assure everyone there was only a short time that the household contact could have potentially been infectious in the community. Investigations are still ongoing into how the infection occurred. This particular security guard had a concierge role in the lobby area rather than a static guard on a floor in the hotel. But at this stage, there is nothing to suggest the guard was doing anything wrong. In regards to the case at the Pan Pacific Hotel quarantine security guard, all close contacts and casual contacts remain negative, with close contacts in quarantine. With the Delta backpacker cluster that we've been dealing with since before Christmas, there have been no new cases for the last 2 days now. And aside from the Perth Mess Hall event, no casual contact has contracted the virus. However, we can expect that we will continue to see some cases pop up over the coming days, most likely amongst those who are already in quarantine linked to the backpacker cluster. But we are confident that this can be contained through our contact tracing efforts. Encouragingly, the 2 Omicron security guard events appear to be contained as well, thanks to the regular testing requirements and the swift contact tracing work. This is an incredible achievement by our contact tracing teams, who have done remarkable work, contact tracing in difficult and unconventional circumstances. What this all suggests is that at present we are on top of the situation and can have confidence in our next step. As a result, based on the latest health advice, from 6 p.m. tonight, some public health measures will be eased. That means mask wearing will no longer be required. Just to repeat, from 6 p.m. tonight, mask wearing will no longer be required for indoor venues or other outdoor major events where it is specifically mandated, like a music festival. Moving forward, masks will only be required in vulnerable settings such as hospitals, aged care and disability settings, as well as on public transport, in taxis and rideshare vehicles. So please keep a mask at hand just in case. We are able to cautiously ease these mask mandates because of the proof of vaccination requirements that are now in place for higher risk venues and events such as nightclubs, larger venues, music festivals and major events. Requiring proof of vaccination for higher risk venues and events means that everyone in attendance or working in these particular venues is safer. It means we massively reduce the risk of another Perth Mess Hall type event. I'm sure this will be a great relief to many, and it's something that we are only able to do because Western Australians did the right thing. When we asked, everyone did the right thing and followed the health advice, and so we were able to get on top of this outbreak. Not to mention our high vaccination rates. As always, we will continually review our settings, including the mask wearing requirements as the situation requires. But for the time being, the public health advice allows us to cautiously ease these public health measures. Now, just one more thing to cover. The Chief Health Officer has issued new health advice related to hotel quarantine protocols. With the emergence of Omicron and the fact more and more people are in hotel quarantine due to interstate arrivals and high-risk close contacts, we have taken a sensible approach to help minimise the risk of transmission in our hotels. As you know, the Commonwealth Government's quarantine facility is yet to be complete, so we need to continue to use our hotel quarantine system to keep people safe. It is crucial that we can continue to safely quarantine high-risk positive cases and close contacts. Therefore, double-dose vaccinated arrivals in hotel quarantine that return negative results on days 1, 5 and 11 will now be released on day 12 to complete their final 2 days of quarantine at another suitable premises. They will also be using the G2G Now app, so police can remotely monitor them and ensure that they stay in place. This will slightly reduce the burden on our quarantine system without any public health risk. And since the introduction of a day 5 test, there has only been one detected case of a day 13 test. So we believe this is a proportionate response to the public health risk. While it's fantastic to be in this position to safely ease mask wearing requirements tonight, it's important to remember that we are not out of the woods yet. We still need people to do the right thing. When you go out tonight or over the weekend, check in on Safe WA. Have your proof of vaccination ready to go. If you're sick, don't go out at all. Stay home and get tested if you've been to an exposure site or have symptoms. And if you are eligible, book in for your third dose. There are still appointments available, and not just for third doses, but also for paediatric doses for children aged 5 to 11. If we all do the right thing, we can keep restrictions light. We can keep the public healthy, and we can enjoy our uniquely Western Australian way of life. Any questions?
The Hyatt Hotel, is there any need for that to close, given he was working on the front desk, that worker there?
No, so let me just characterise better how the role of this particular security guard. He's essentially in a crowd control capacity, so meets passengers when they first alight from the bus, directs them in the right direction, and collection of baggage and so on. So he wasn't a static guard, as we often see in these situations, but as I said, we're very confident he did all the right things. It's just an unfortunate situation, and very pleased that none of his colleagues have contracted the disease.
And the household contact, what does he do for work?
He's the household contact.
The household contact
is a female. Yeah.
Yeah.
I understand she works in a health setting, and all her work colleagues and all obviously we're in the process around casual contacts, but all her work colleagues who are close contacts have been tested and tested negative.
So in a hospital? Or
No.
Aged care facility?
No.
So the close contacts, you said the majority have come back negative. Do you have an exact figure on the close contacts?
No, we don't, but I'm very happy to get that for you, Peter. It's at this stage, as I said, we have 23 close contacts for the security guard and the household contact, and as I said, the majority at this stage have come back negative.
Has that workplace that the close contact works at been shut down at all?
No, that wasn't required.
So just to check, 22 or 23?
23.
So is the assumption the guard got it in that sort of when the new guests were coming in, or what's the understanding of how he's actually monitored?
Yeah, that was his primary role, so that's obviously the working theory. As I said, the reason why we were able to pick up this particular case is because of the stringent arrangements of daily testing that we have for our hotel quarantine workers, which in this case, and the case also of the Pan Pacific security guard, has been shown to work. And as a result of those daily testings, we've been able to get on top of the issue and ensure that there hasn't been any extensive transmission of the disease.
So sorry, do you have to clarify, obviously the health setting could be a broad range of things.
That's right.
So are you able to clarify anything specific around what sort of workplace we're talking about?
Look, those sites are on the Healthy WA website in terms of exposure sites, and you'll probably be able to deduce in the context of that.
The nurses' unions come out today saying that majority of its members don't believe that their workplaces are ready to be open on the 5th. They want to push back a month to the 5th of March at least. Is your government toying with the idea of changing the date, or do you firmly believe that we're ready to reopen on the 5th? That's where specifically hospitals can cope with the patient surge.
Well, look, we haven't received any advice from the Chief Health Officer or the State Emergency Coordinator in relation to the 5th of February. That's the date we are working to. That's the date everyone is working to. Obviously, we continue to be advised, and there's a few weeks to go yet. And one of the great opportunities that Western Australia is afforded by delaying our opening is that we can see how this is impacting on other states. We do know that high vaccination rates has a significant positive impact. We do know that we need to continue to make sure that our hospitals have got the resources and the staff that they need to be able to respond as inevitably the disease comes into our community.
So in that time, what are we learning and what are we doing differently?
Obviously, all the states are trying to vaccinate as many people as they can. What are we doing differently that will help us come border opening?
Well, specifically, we're obviously getting a high level of third doses going through now. As I said, around about 1% a day are getting vaccinated with their third doses. Currently, that is for just 18 and over. So obviously, that will significantly improve the resilience of the Western Australian community to deal with the impact. What we're also obviously doing is continuing to monitor how this disease is impacting in other states. And that's why we've responded as we have to date, and we continue to make sure that we learn from those experiences. Anecdotally, what we see is that there is a high uplift in relation to the number of doses, number of cases, because of the transmissibility of the Omicron variant, but we see it's not as impactful in terms of the acuity in terms of our hospital settings. You see at the moment there's still a large number of ICU cases on the East Coast. Primarily they are still Delta cases that are making their way through the system. So we can learn from that. We can make sure that we've got the general beds that we need in our hospitals ready to go, and make sure that we've, as a community, we are able to respond to the impact of incoming travellers as well.
With the latest announcements to public health measures.
Sorry?
With the latest announcements to public health measures, they're very similar, if not the same, as what was expected to be introduced on February 5.
That's correct.
Do you have any update on if restrictions will be harsher come that date, seeming as cases over East continue to climb?
Well, look, at any stage of the global pandemic, you have to be ready to pivot to the new, against the new evidence that you're presented. And obviously we'll continue to be advised by the Chief Health Officer and others in relation to what we have to do as we approach the 5th of February. These are the appropriate measures in place now with the public health risks that we have, and they are proportionate. And I think Western Australians should be proud of the way they responded over the last couple of weeks, both in relation to mask wearing, but in particular in relation to proof of vaccination at those high-risk venues. So people have to be ready. We have to be ready to respond to whatever the risks are. And we can't provide you with any certainty in terms of what those risks can be. What we can provide you with certainty is that we will take the necessary steps to keep the Western Australian community safe, and to make sure that we are not overwhelmed in relation to the disease, so it overwhelms our hospitals. Sorry, one at a time. Josh.
Back the start of its school term by 2 weeks. Has any consideration been given to that in Western Australia?
No, look, we'll take advice from the Chief Health Officer in due course in relation to that. I do note the comments by the Queensland Premier. That's not a part of our consideration at this stage. We will obviously welcome parents taking their children between 5 and 11 to get them vaccinated when those vaccines become available through our GPs, pharmacies and state clinics next week. That's a great opportunity to continue to build up the overall vaccination rates, and we'll continue to monitor the situation just in relation to the new school year.
How confident are you that there are enough vaccines for 5 to 11-year-olds? We're hearing of people who their appointments have been cancelled because their GPs don't have the vaccine. How confident are you that we're going to be able to get enough kids vaccinated before school starts?
Well, look, as you know, this is not my first rodeo when it comes to relying on the Commonwealth for the delivery of the vaccine. So we're monitoring that situation closely. And I do note the comments from the Pharmacy Guild today and by the GP sector in terms of their disappointment about the low numbers which are being delivered. We are being reassured about the numbers that are available within the nationally. But of course that doesn't mean anything unless we can get them into our clinics. We urge the Commonwealth to do everything they can to meet the demand. We know that there are people out there that want to get their kids vaccinated, want to continue to protect themselves. And it's important that we ensure supply of those vaccines to meet that demand.
If parents can't get their kids vaccinated, do you concede that there will be some parents who won't want to send their children to school?
Look, I won't speculate on what's going to be the settings in 2 to 3 weeks' time. But we just want to reassure parents that we will maintain a safe school environment. That can be, and obviously vaccines play an important role for that. So if you're anxious, please take your kids to get them vaccinated. There will be vaccines available right through January, and as you know, those parents know that's the best way to keep each other as safe as possible during these times.
Are schools being prepared at all for the possibility of having to start the term with online learning and not physically actually going into the classroom?
Well, look, obviously, the Education Minister and the Director General are working closely together to deal with any eventuality that may come in relation to the new school year. At this stage, we don't see any reason why there should be a need for online learning or for kids to be kept away from school. But we'll monitor the situation, and importantly, we will follow the health advice at the time based upon the evidence that's before us.
We've seen other states progressively add more and more restrictions in an attempt to stop Omicron from going absolutely crazy. Is the WA government's approach more likely to have those restrictions in place from February 5 rather than have a light touch to start with and then add things?
Yeah, as you know, we've always taken a cautious approach in Western Australia, and that's been one of the keys to our success in maintaining a safe environment. You saw in some of the other states where they dismantled some of their capacity and their infrastructure, brought down quarantine facilities, cancelled the QR code check-in system. We certainly won't be following that example. We'll make sure that we have everything at our disposal as we should we have the need to then scale up our response. But at this stage, based upon what we're expecting, come February 5, we have everything in place that we need. Key element of that, of course, is vaccination. So as I said earlier, if you haven't yet had your third dose, please book in to get your third dose. With the Omicron variant, we know the third dose is a game changer in terms of protecting you against the virus. So everyone, do the right thing and ensure you get yourself vaccinated, particularly for the third dose, as soon as possible.
Who will have access to the rat test when they come in, and sort of who will pay for them?
Well, as I announced earlier this week, that the Chief Health Officer will soon issue a revocation in terms of the banning of use of the rapid antigen tests in Western Australia. We are still working up the guidelines based upon both national considerations and state needs in terms of the rat tests. I'll ask the Chief Health Officer to make comment shortly, but what he will probably tell you is that when you have a situation where you don't have widespread incidence of the disease, the rapid antigen testing is of fairly limited value. And is really just about feeding your curiosity in the event that you're feeling unwell. PCR testing remains the gold standard, and that's what we rely upon for the foreseeable future, until you see a situation where you do have widespread incidence of the disease.
With that data, like in other states down the track, do you think you'll ask people who take a rat test to report that data to WA Health so they can sort of keep an eye on what's happening?
Again, I'll ask the Chief Health Officer to comment, but absolutely having line of sight in terms of the disease, how much there is, and where it is a very important part of controlling the public health safety.
New South Wales is looking to close down nightclubs. Is one of those measures Josh was talking about before in terms of the scale up. We saw here with our sort of Christmas, New Year's period restrictions, a similar thing happening to stop spread. So if we're getting to that situation again where we're trying to spread out the curve, not have everyone going overwhelming the hospitals at once, is that just looking like a very likely kind of restriction post-Feb 5, that we will have tougher restrictions on nightclubs, places that can have big spreading events just given their nature?
Well, I won't speculate in terms of the decisions that might be taken in the future, because it will ultimately depend upon the situation we're confronting. We know masks go a long way to making people safer in the community. We know vaccination goes a long way for keeping people safer in the community. We also know that keeping people away from higher risk events and venues is another way that we can keep people safe, which is the reason why we had those restrictions around dancing, around nightclubs and so on just recently. So you'd have to anticipate that it is part of your arsenal in terms of keeping people safe. But in the meantime, if we're continuing to make sure that people are vaccinated, if we ensure that people are doing the right things with mask wearing, if we ensure that we continue to use the Safe WA app or its new iteration, which will include the proof of vaccination, which will be introduced next week, well then we rely less upon these other more harsher measures, such as closing down whole sectors of our economy, which is obviously one of the things that we're focused on.
So, a particular date that you're going to is there a particular date before Feb 5? Is it a week out? Is it 2 weeks out? Where we sort of find out the kind of restriction levels, and how reliant are those settings on having an understanding of Omicron modelling for WA? Do you know when you're going to get some of, if that's coming at all, when you might be able to get that, and when these decisions can kind of be made?
So could you ask that second part of that question again?
When are you sort of expecting to get Omicron modelling?
Right, okay.
Are we anticipating modelling for it? And
Yeah.
are our settings going to be fairly tied to what that says?
Yeah, so two good questions there. Firstly, in relation to in relation to an announcement around these things, obviously the Premier and the Minister for Health, informed by the decisions of the emergency management team, will make decisions prior to the 5th of February, so that people have plenty of notice. But the measures that we've announced today in terms of the easing of restrictions with masks in those high-risk settings such as public transport and so on, you can understand that they will be part of the new measures when we transition. But we'll continue to monitor the situation in the lead up to the 5th of February and provide people with plenty of notice if we expect any additional measures to be put in place. Now, as you allude to, some of that will be on the basis of what we expect the world to look like once Omicron comes into the Western Australian community. We've asked WA Health, and obviously they're onto this anyway, to undertake some modelling around what that looks like. That modelling is still being worked on because we are waiting for stronger evidence to come through from the East Coast and internationally in relation to the way the disease is transmitted, the infection rates, the acuity and the hospitalisation rates, and we'll be able to make further decisions on the basis of that.
Are there any particular states you're focusing on when trying to learn from how they're managing the spread? Obviously Western Australia looks very different to New South Wales based on population density. Is there any state you're focusing on try and figure out which would best suit Western Australia's population?
No, I don't think so. But obviously we look at all states' experiences, particularly their policy responses and whether they are suitable for Western Australia. As you allude to, Western Australia has a unique setting. We are an isolated community, which is the reason why, in addition to contact tracing, quarantining, isolation and testing, that our borders have provided a vital part of our response. So Western Australia does have a unique set of characteristics which informs our response. But we look not only to the East Coast or to the eastern states, but we look to jurisdictions right across the world in terms of what we believe is world's best practice in terms of both our expectations and in relation to how the disease will impact our community, but also in terms of our response, in terms of public health measures.
In the Northern Territory, they're essentially locking down everyone that's unvaccinated now. Is that something you think could happen in WA? We also have remote communities in the same way that they do.
Well, as you've noted, as we've noted in the past, the low vaccination rates in our community, and you look at the first and second dose vaccination rates, they're low. In terms of third dose, they're devilishly low. And so we need to make sure that we look at other measures to protect those communities if we don't have high vaccination rates as part of that in our quiver of measures that we can bring to bear. Making sure that we can isolate those communities is part of that. And in some of these communities that are very close to the Northern Territory border, that it becomes very challenging. But we need to also make sure that we do everything we can to protect those people. So the big effort at the moment is to continue to push those vaccination rates up, first, second and potentially their third doses, But if we don't get the outcomes in relation to that, we'll need to look at other measures, such as making sure that anyone going to those communities is only already triple dosed and returns a negative result.
More broadly, though, could we see Perth residents that haven't been vaccinated told that they can't leave their homes?
Look, that hasn't been raised with me, and it certainly isn't any part of any health advice that we've received. But what you're seeing in our high-risk venues at the moment around proof of vaccination gives you an insight or a window into the future of how we're going to be responding to this. And that is people who have got themselves double and triple dose vaccinated will obviously have greater freedoms than those who at this stage resisted the opportunity to get themselves vaccinated.
You mentioned the pan pack and the risk there is seems like it's been mitigated. There's a couple in there at the moment who had an end of life visit cancelled because there could have been a risk with the security guard, given that, as I said, it has been mitigated. Should that end of life visit, do you think, go ahead so they can say goodbye to their loved one?
Yes, my understanding is that things have been put in place to make sure that happens as quickly as possible. Obviously, there was complicating factors in relation to the pan pack, but those issues, my understanding is, have been overcome, and that visitation opportunity has been arranged.
So that couple will get to see that.
Correct.
On the good to go passes, we've been told about people trying to apply for after February 5 to come back into the state, but just sort of getting an automatic knockback based on the current border restrictions that exist, extreme risk for most
Yep.
states and territories. Is it a simple fact that people won't be able to apply until after Feb 5 when we know the settings and when people approving those passes are operating off those settings?
Look, you're quite correct. At the moment, you can't apply for a GTG pass beyond the 5th of February. I suspect that situation will change as we approach the 5th of February, but it really depends on the public health advice that exists in the lead up to the early February.
Do you know what percentage of aged care residents have received the booster shot in Western Australia?
No, I don't. That's the responsibility of the Commonwealth. It's a good question because obviously they're a vulnerable cohort. Certainly the ongoing measures in relation to mask wearing and ensuring that staff are properly vaccinated, and indeed I suspect the expectations on visitors to those settings as well will be an important part of keeping them safe. But in relation to how many have received their third dose, that's not that's not part of our operational responsibility, and the Commonwealth is really responsible for rolling that out. I do hope they're making progress because they're a very vulnerable part of our population, and you've seen how devastating COVID-19 can be once it takes hold of an aged care facility.
Do you know how many? Do you know how many ICU beds in our health system are dedicated to COVID patients, especially the after the opening day after February 5th?
Are dedicated to?
Are dedicated to COVID patients.
All right. No ICU beds are dedicated to COVID patients as such. We recently announced that we were expanding the number of ICU beds available in Western Australia, including a pod of 20 odd beds at RPH and another further 10 beds at Fiona Stanley Hospital, and then a few others elsewhere, taking I think to an increase of around about 40. Now they won't necessarily be dedicated as COVID-19 beds, but they will obviously be COVID-19 enabled, and we will ensure that the staff who are working at those beds are capable of looking after patients with COVID-19.
A lot of country hospital emergency departments double as COVID testing centres as well within the department. When the border comes down, is there a plan for that to maybe change when testing ramps up?
I haven't received any information in relation to that, but obviously we will need to make sure that we can continue to have those emergency departments receiving patients that need care, but also can continue to make sure that we take these public health measures in relation to COVID.
So I know, just back to ICU beds, we can surge up to 300. You talked about the new beds coming online. How many ICU beds will we have just operating Feb 5? Because I think we're about 150 something ICU beds sort of running at the moment.
Look, I don't have those numbers with me at the moment, Peter. as we confirmed late last year, as part of the $3.2 billion funding, which includes the funding in the budget and the mid-year review, we are seeing a significant increase in the number of beds available to Western Australians in our public hospital system. Overall, 570 beds, extra beds, will be created between now and the middle of next year, including 120 modular beds, which will be online in April, and an extra 80 beds, which will be available online by February this year. So that will be an incredibly important boost to our hospital system in the event that we do see an increase in the rate of hospitalisation. If I can just finish on in relation to that, our expectation in the way that we are seeing Omicron manifest itself in other jurisdictions is that we'll have an overall increase in demand on general hospital beds. However, it's not looking like that we're seeing the same impact in terms of ICU beds in terms of Omicron. The ICU hospitalisation rates you see in the East Coast at the moment are still primarily Delta-based patients, and we're not seeing a big increase in the number of ICU patients as a result of Omicron.
There's 1,700 people, I think, in hospital in New South Wales with COVID at the moment. Do we have 1,700 free beds if the same thing was to happen here?
Well, we're not expecting, based on population numbers, we're not expecting to need the full the full 1,700. As a result of our mid-year review decisions, we increased the number of beds that we'll be funding by 270. That is consistent with the modelling which has been done around the expectations around hospitalisation rates and in relation to COVID-19. So in terms of the hospital system, we have a living with COVID scenario, which is just COVID is part of our lives, and we need to make sure that we can care for those who are exhibiting acute symptoms. But we also have a surge capacity, and that is in the situation whereby we have big increases in hospitalisation rates. We can then pivot around our private hospitals, but also making sure that we can look at diverting business as usual patients to private hospitals so that we can free up public hospital beds for COVID patients. And also, of course, you will start to step back from some of your elective surgery as part of that surge response as well. And you're seeing that in New South Wales at the moment.
I think it's only 4% of the cases today. So, I mean, are those numbers, yes, the case numbers are shocking, but given the hospitalisations are that high in the grand scheme of things, is that refreshing data for your sort of government to look at? Not refreshing is probably not the right word.
No, I know what you mean.
Do you think it's...
Well, I think it's certainly a relief to everyone to hear, to get the sense, and obviously the scientific evidence is starting to point in this direction. The chap down here, known as the Chief Health Officer, would give you a more scientific response here. But certainly I think everyone's relieved that at this point in time, Omicron doesn't seem to be as severe in terms of symptoms, and as a result of that, even though you have hospitalisation, you don't see the big increase in ICU rates. And that's obviously, if that comes to pass as being the ongoing experience of Omicron, well, that would obviously be a big relief to everyone.
Can I just pivot to the economy?
Is there any more questions for me before we go to...
Can I just ask one about the economy? Given the high case numbers in New South Wales and Victoria, the supply chains are being hit. How concerned are you that we're going to have supply shortages here, like even within the next 2 weeks, because of the number of cases of truck drivers?
Yeah, look, I think it is a concern. Supply chains is a concern. The overall workforce impact across a whole range of industries you're now starting to see take effect. And in terms of our big supermarket chains, I know that they rely very heavily upon their national supply chains in terms of their situation. Look, I haven't received any advice. The government hasn't been told of any supply shortages for Western Australia, but this is a reality of COVID-19. We, at least at the moment, by virtue of the fact that we have managed the disease as a community, not as a government, but as a community, we've managed the disease so well that we are one of the few places in the world where you see both a low incidence of disease and a very low impact on the economy. In fact, an expanding economy at the same time that we have low incidence of the disease. That's a fantastic outcome, and we obviously want to make sure that that continues. Our supply chains, our workforce, will continue to be challenged by the scenario as we go forward. But I think the Western Australians have demonstrated that they have the mettle and the courage to do all the right things to make sure that we can keep each other safe. We've demonstrated that since just before Christmas, through mask wearing, through vaccination regimes, and through proof of vaccination regimes in our hospitality sector. We're very proud of the West Australian community, and we thank everyone for their hard work.
The Eastern states are seeing, they're working to reduce the wait times for PCR tests. They saw queues in the hours, people waiting and multiple days to get results back. At the moment, when the borders open on February 5, PCR tests within 72 hours are still what's needed to enter WA. Is there any work being done to change that or extend it for people if these testing lines continue to stay, a couple hours or days?
Yeah, so you'll recall when we made our first announcements where there was an expectation that people would receive a negative PCR test before coming into Western Australia, having been tested in the other jurisdictions. We've obviously had to pivot around that to make sure that as people get tested within the first 24 hours of coming into Western Australia, of course we require them to be double dose vaccinated before they come in. We need to continue to monitor the situation. At the moment in WA, we have huge capacity in terms of our testing and in terms of our testing facilities. We still have our great partners in the private pathology sector who are also part of that big capacity that we have. So again, because we've done the public health measures to reduce the incidence of the disease, because we're able to wait before opening up our community in terms of Omicron, we can see how this is best managed in other states. You see they're all pivoting to rapid antigen testing now, and my understanding is the science says that makes sense when you have high incidence of the disease, as opposed to what we have. So you can imagine that at some point in the future that may be part of Western Australia's reality. But at the moment we have low incidence of the disease. PCR test remains the gold standard. It's what informs our system. It's what keeps people safe and what allows us to continue to put the public health measures to ensure that we don't have further transmission of the disease. So we're going to continue on in this vein at the moment because we know that's what works.
But just to clarify, you said that you've pivoted, but on the website it does still say that that's mandatory 72 hours before entering. Just checking that it does just check the government website.
We'll look at the website.
Okay.
Yeah, so, and obviously Andy can provide clarity, some more clarification in terms of that. All good? Thank you very much.
Doctor, just to clarify on this household contact to the female from the Hyatt Hotel, the household contact of that worker who
Yes.
has Omicron that is working in a health setting that the Acting Premier mentioned. Acting Premier hinted the exposure site, or her workplace would be an exposure site, which I haven't seen on the list yet myself. So can you clarify what setting she was working in and whether it's
So she was
considered
working in
infectious?
a small medical practice. There was a limited